As someone who's had back surgery myself, I particularly can empathize with these patients. I know exactly what they're going through. I'm a registered nurse and a physician assistant, and I see patients day to day with Dr. Deuk, as well as take care of the operating room. I'm the director of nursing in the operating room itself. I became a nursing assistant, and then an emergency medical technician, and then a registered nurse, then a charge nurse. Went to the emergency department at a local hospital. Went to Stanford to PA school, and came back here to my home. I started with Dr. Deuk about 6 years ago. I was working in the emergency department as a physician assistant, and Dr. Deuk was introduced to myself, and he was, to say the least, a dynamic personality. We started talking, we hit it off, and took it from there. He's got a disc herniation here that's around 3-4. He may have re-herniated or herniated at another level. So, want to go see him?
Yes.
The staff is fantastic. He is very fortunate to have such a great staff. The MAs are highly trained. The front office staff, highly trained as well. The clinical staff, we all have at a minimum ACLS and advanced training in our specialty. Patient safety is our primary concern. In terms of laser procedures, we've done over 200, and we've had 0 complications, which compared to any other specialty is unheard of. So patient safety, the success of our practice, and low complications. That's what we strive to obtain. Anyone that comes in here is fortunate that they're here, because as far as spine surgery, he is absolutely the best. And I know, for myself, being affiliated with him for about 6 years now, I've seen a lot of surgeons come and go, a lot of practices come and go. Having had surgery on my back as well, I can tell you that he is definitely one of a kind. Part of my job is to pull up films and review them prior to Dr. Deuk seeing the patient. So we come up with a plan. This is a C-spine MRI of an earlier patient. Typically, a patient is brought to a room by one of our MAs or patient navigators, and then I will go in and meet them, sit down with them, talk with them, examine them, find out exactly what's bothering them. Oftentimes, they're in a lot of pain, either neck or lower back. And it's gratifying to see them after we've treated them, because the vast majority of the time that pain's gone. And they're different people, literally.